Phlebotomy exam prep. Question 1. Which of the following is a reason to perform a capillary puncture instead of a venipuncture? Small blood volume needed. Patient has fragile veins. Patient is an infant. All of the above. Capillary puncture is preferred when only small blood volumes are needed, for patients with fragile veins, elderly, oncology, and for infants under 12 months. This method is less invasive and reduces the risk of vein damage while providing sufficient blood for many point-of-care tests. Question 2. What is the purpose of the bevel on a needle? To reduce pain. To facilitate smooth entry. To prevent infection. To increase blood flow. The bevel, slanted tip, allows for smoother, less traumatic entry into the vein by gradually separating tissue layers. A bevel-up orientation during insertion further reduces resistance and patient discomfort, improving venipuncture success rates. Question 3. Which of the following is a sign of an arterial puncture? Bright red blood. Slow blood flow. No blood return. Dark red blood. Arterial blood is bright red because it is oxygenated and flows under high pressure, often spurting into the tube. Venous blood is dark red and flows steadily. Accidental arterial puncture requires immediate removal and prolonged pressure to prevent hematoma formation. Question 4. What do you do if you accidentally puncture an artery? Apply firm pressure. Ignore it. Continue drawing. Apply a band-aid only. Apply firm pressure to the puncture site for a minimum of 5 to 10 minutes to stop bleeding and prevent hematoma formation. Notify your supervisor immediately. Arterial punctures carry higher bleeding risk than venous punctures due to higher pressure in arteries. Question 5. Which tube is used for glucose testing? Red tube. Gray tube. Blue tube. Green tube. Gray top tubes contain sodium fluoride, glycolysis inhibitor, and potassium oxalate, anticoagulant. The fluoride prevents red blood cells from metabolizing glucose, preserving accurate glucose levels for up to 24 hours. This tube is essential for glucose and lactate testing. Question 6. What is the best way to identify an unconscious patient? Ask a family member. Check the patient's ID band. Guess based on appearance. Ask another patient. The patient's ID band contains 2 unique identifiers, e.g., name and medical record number, and is the most reliable identification method for unconscious patients. Never rely on family members or appearance alone, as this can lead to misidentification errors. Question 7. Which of the following is a complication of prolonged tourniquet application? Hemoconcentration. Hemolysis. Petechiae. All of the above. Prolonged tourniquet application, 1 minute, causes hemoconcentration, concentration of blood components, hemolysis, cell damage from pressure, and petechiae, capillary rupture. The tourniquet should be released as soon as blood flow is established to prevent these complications. Question 8. What is the recommended site for heel stick in infants? Center of the heel. Lateral or medial plantar surface. Big toe. Ankle. The lateral and medial plantar surfaces, sides of the heel, are recommended for infant heel sticks because they avoid the calcaneus bone. Puncturing the center risks bone injury and osteomyelitis. The puncture depth should not exceed 2.0 mm for safety. Question 9. Which of the following is not a proper way to mix blood in a tube? Gently invert. Shake vigorously. Roll between hands. Invert several times. Shaking vigorously causes mechanical shear stress that ruptures red blood cell membranes, resulting in hemolysis. Tubes should be gently inverted 5 to 10 times to mix blood with additives without damaging cells. Rolling between hands is also acceptable for some additive tubes. Question 10. What is the main reason for labeling specimens at the bedside? To save time. To prevent mix-ups. To make it easier for the lab. To reduce paperwork. Labeling specimens immediately after collection while still at the patient's bedside ensures correct patient identification and prevents specimen mix-ups. This is a critical patient safety measure required by accrediting organizations and reduces the risk of mislabeled specimens. Question 11. Which of the following is a sign of infection at the venipuncture site? Redness and swelling. Bruising. Itching. Numbness. Redness, swelling, warmth, and tenderness at the venipuncture site are signs of possible infection, cellulitis or phlebitis. Patients should be instructed to monitor for these signs and report them to their healthcare provider. Bruising alone may indicate hematoma, not infection. Question 12. What is the correct action if a patient refuses a blood draw? Force the patient. Notify the nurse or physician. Ignore the refusal. Draw the blood anyway. Patient autonomy must be respected. Forced blood draw is illegal and unethical. Notify the nurse or physician of the refusal so they can counsel the patient or arrange alternative testing if necessary. Document the refusal in the medical record. Question 13. Which of the following is a reason to avoid drawing blood from an arm within 4? Risk of contamination. Dilution of sample. Possible inaccurate results. All of the above. Drawing blood from an arm with an active 4 infusion risks contaminating the sample with 4 fluid, diluting analytes, and producing inaccurate test results. The venipuncture should be performed on the opposite arm whenever possible, or below the 4 site after the 4 has been paused for adequate time. Question 14. What is the best way to prevent hemolysis during blood collection? Use a small gauge needle. Draw blood slowly and gently. Shake the tube. Use a dry tube. Gentle, slow blood collection minimizes mechanical stress on red blood cells, preventing hemolysis. Using too large a vacuum, excessive syringe suction, or a small gauge needle with a large tube can also cause hemolysis. Always fill tubes to the proper volume and invert gently. Question 15. Which of the following is a common cause of specimen rejection? Hemolysis. Clotted sample for CBC. Incorrect labeling. All of the above. All 3 conditions lead to specimen rejection. Hemolysis releases intracellular components that interfere with tests, clotted samples cannot be used for CBC, and incorrect labeling compromises patient identification. Proper collection and handling techniques prevent these errors and avoid recollection. Question 16. What is the purpose of the requisition form? To identify the patient. To specify tests to be performed. To provide billing information. All of the above. The requisition form contains patient identification, ordered tests, specimen collection information, and billing data. It serves as the communication link between the provider and laboratory, ensuring correct tests are performed on the correct patient. Incomplete or incorrect requisitions cause delays and errors. Question 17. Which of the following is not a standard precaution in phlebotomy? Hand hygiene. Wearing gloves. Recapping needles. Using PPE. Needles should never be recapped because recapping is a common cause of needle stick injuries. OSHA prohibits recapping unless a mechanical device or one-handed scoop technique is used. Hand hygiene, gloves, and PPE are all standard precautions required for blood collection. Question 18. What is the correct action if you accidentally stick yourself with a used needle? Wash the area and report immediately. Ignore it. Continue working. Hide the incident. Immediately wash the puncture site with soap and water, then report the incident to your supervisor. Follow facility protocol for post-exposure evaluation and prophylaxis. Prompt action reduces the risk of bloodborne pathogen transmission and ensures proper documentation. Question 19. Which of the following is a reason to use a butterfly needle? Small or fragile veins. Large veins. Arterial puncture. Capillary puncture. Butterfly needles, winged infusion sets, are ideal for small, fragile, or rolling veins in pediatric, geriatric, and oncology patients. The flexible tubing and small gauge reduce vein trauma and provide better control during difficult draws, improving first stick success rates. Question 20. What is the correct action if a patient has a seizure during a venipuncture? Restrain the patient. Remove the needle and protect the patient. Continue drawing. Leave the room. Immediately remove the needle to prevent injury, then protect the patient from harm by moving furniture away and cushioning the head. Never restrain a seizing patient. After the seizure subsides, assess the patient and notify the provider. Do not leave the patient unattended.